I am Dr. Brenda Jimenez, third-year fellow in the Department of Gastroenterology and Hepatology in Cleveland Clinic, Florida. On behalf of my co-authors, I am pleased to present our findings on a study to be published by Gastrointestinal Endoscopy entitled Comparison of Adenoma Detection Rate in Hispanics and Whites Undergoing First Screening Colonoscopy. Current guidelines recommend screening colonoscopy beginning at the age of 50 for the average risk population. In addition to age, factors like race may influence the risk of colorectal cancer. The Hispanic population is the fastest growing minority in the United States, comprising 16% of the total U.S. population. Colorectal cancer is the second most commonly diagnosed cancer among U.S. Hispanics. However, U.S. Hispanics continue to have a lower incidence and mortality rate from colorectal cancer compared with non-Hispanic white Americans. Surprisingly, little data exists on the prevalence of colon polyps among U.S. Hispanics. The aim of our study was to compare the adenoma detection rate between Hispanics and whites undergoing their first screening colonoscopy. We also aim to evaluate the influence of race on the total number of adenomas per patient, location of polyps, defined as distal or proximal to the hepatic flexure, and prevalence of advanced adenomas, which were defined as polyps with villous features, high-grade dysplasia, or greater than 1 centimeter. We included patients aged 50 or greater undergoing their first screening colonoscopy. We carefully reviewed the records, and patients whose race was determined as either white or Hispanic were included in the study, for a total of close to 1,900 colonoscopies. 32% of the patients in our study were Hispanic, with no differences between the two groups, except for there being more females in the Hispanic group. The adenoma detection rate in Hispanics was 45% and 48% in whites, which was not a statistically significant difference. There was no difference in the adenoma detection rate when comparing male and female Hispanic and white subgroups, and no difference was found with regards to location or advanced polyps. Our findings, in addition to current evidence, can have important implications for colorectal cancer screening in Hispanics. For example, the higher incidence of colorectal cancer and adenomas in blacks has led to the recommendation to begin colorectal cancer screening at the age of 45. In Hispanics, however, the current evidence is conflicting. While some authors propose a similar adenoma prevalence among whites and Hispanics, others have found a higher prevalence in Hispanics. Current evidence also suggests that there is a lower incidence of colorectal cancer in Hispanics. There are several factors that could account for the differing results in studies and the similar adenoma prevalence despite the lower colorectal cancer incidence. Hispanics comprise a diverse group that by definition includes any race and multiple countries with differences in genetic composition, which may render different risks for colorectal adenomas, and the findings seen in one cell population may not be generalizable for the entire Hispanic population. Other possible contributing factors include acculturation, which is the process by which immigrants adopt the attitudes, values, customs, beliefs, and behaviors of their new culture, as well as differences in access to screening. Prior studies have shown that Hispanics are less likely to have had a recent test for colorectal cancer than non-Hispanic whites. We also found that the proportion of males in the Hispanic group was lower than in whites, which has been reported in other studies as well. In a study that tried to understand the rationale for this possible lower screening rate among Hispanic men, the authors found that Hispanic men expressed concern over colonoscopies being potentially transformative or stigmatizing. By understanding this and other social-cultural factors that can act as barriers to screening, we can help develop interventions to improve screening practices among the Hispanic population. In conclusion, we found similar adenoma detection rate among Hispanics and whites, as well as similar prevalence of advanced adenomas, suggesting that the current colorectal cancer screening recommendations are appropriate for Hispanics. However, further research in Hispanic subgroups is warranted to determine if these recommendations can be generalized for the entire Hispanic population or if different recommendations should be made for different subgroups.